Previously, guys, we looked at the concept of acute heart failure. We said that it's a type of heart failure that is starting all of a sudden. Okay, the onset is rapid. Okay, and it's actually taking you down so fast and all the stuff. Right. So let's talk about the chronic type. If you say someone has a chronic heart failure, what do you mean? All right. Let's discuss chronic heart failure. Basically, we'll be looking at the definition and the presentations. All right. So, getting to the heart of the matter, that's basically chronic heart failure. Let's have it. We say that congestive heart failure or heart failure is a long-term condition in which your heart can't pump blood well enough to meet your body's needs. Okay, so you could call congestive heart failure or chronic heart failure. Okay, anything that is long term, okay, any type of heart failure that is long term has been there for a while now is basically a chronic type. Okay, so it means that your heart is still working, but because it can't handle the amount of blood it should, blood build up in other parts of your body. Okay, so chronic heart failure means what? The heart, being the central, is not recycling blood as it should. Okay, so that means deoxygenated blood mainly, okay, is like being piled up in some parts of your body and all this stuff, okay, and that can actually cause you a problem. All right, that can actually cause tissue death, necrosis. It can cause ischemia, all right, cause muscle weakness and all this stuff. So for chronic heart failures, we say that patients who have chronic heart failure for some time, sorry, patients who have heart failure for some time are said to have chronic heart failure. That means your heart failure has been there over some time, right? It has been there for a while now. Okay, so no or mild symptoms and signs that have not changed recently for the last 1 month. All right, so these are top criteria for determining if a heart failure is chronic or not. So you just have a steady symptoms that have not changed for the last 1 month. Okay, the patient, every time you see the patient, is just looking like that, just complaining about it, about the same thing, about the same level and all this stuff. So that means what? The patient is stable. Right, so if chronic stable heart failure deteriorates, the patient may be described as what? Decompensated. Okay, if your condition from the chronic it gets worse, that means what? You are decompensated. For you to remain at a stable level, that means your body was trying to like compensate. Okay, so this chronic heart failure may happen suddenly or slowly. No, this is decompensation, right? This decompensation, that means basically your body is losing the ability to compensate. So the body losing the ability to compensate can happen suddenly or slowly, right? And this will often lead to what? Hospital admission. All right. Event of considerable prognostic what? Importance. All right. So basically, this is what is known as the chronic heart failure. Basically, a type of heart failure that is what? Killing you slowly. All right, eating you up slowly and all that. All right. So see you guys.